Welcome to this explainer. Pregnancy can be an absolutely beautiful season, but let's be totally honest for a second. It can also make your nervous system feel like it's just constantly on edge. It's almost like you've somehow chugged 3 cups of coffee right before you were supposed to fall asleep. So today we're going to unpack a really fascinating topic: how calm, predictable sounds can actually act as a gentle sensory support tool during pregnancy. We're diving straight into the science and the practical application of ASMR, with a massive focus on practical, low-volume listening guidelines and exactly where those strict medical safety boundaries lie. Here's exactly how we're breaking things down today. First, the pregnancy alert state. Second, what prenatal ASMR actually is. Third, the science of sound. Fourth, those crucial low-volume listening guidelines. And finally, strict medical safety boundaries. Let's get into it. Section 1. The pregnancy alert state, where the nervous system is on watch. We really need to ground ourselves in the physical and mental reality of pregnancy first. It is a wildly demanding season where your body is doing some monumental work, constantly monitoring for safety and for change. Let me ask you this. Does it ever feel like your nervous system is just always switched on? Like you're constantly listening for the baby, or listening for a new symptom, or kind of just bracing yourself for whatever change your body is going through next? Well, that heightened vigilance is completely normal because your body is intuitively monitoring your safety, your sleep, and any pain. But man, it can be utterly exhausting, right? The core problem here is that pregnancy essentially amplifies normal, everyday stress. It creates this constant alert state that often leaves you feeling physically completely wiped out, but mentally wide awake. You might desperately want to relax, but suddenly you find that pure silence just makes your worries louder. You're searching for a gentle way to downshift, and honestly, that's exactly where our topic today comes into play. Moving into Section 2, what is prenatal ASMR? We like to think of it as a low-effort anchor. Okay, so let's define our terms so we're all on the same page. ASMR stands for Autonomous Sensory Meridian Response. For some folks, they experience it as this really pleasant tingling sensation that usually starts around the scalp or the back of the neck. But here's what's absolutely crucial to remember. Even if you don't feel those physical tingles, ASMR can still trigger a profound feeling of calm, sleepiness, and physical comfort, using literally nothing but soft, predictable sounds. Think about things like whispering, soft speaking, slow hand sounds, or just the gentle flipping of book pages. What do all of those have in common? They're all about slow pacing and social safety. During pregnancy, when your body is changing so fast and physical comfort is honestly just hard to find, traditional meditation or strict breathing exercises can feel like way too much work. A gentle voice and a steady rhythm, they just offer a low-effort anchor. You don't have to work for it. Now, we absolutely must make a clear distinction here. ASMR is not a medical treatment. It's never a substitute for actual prenatal care. It doesn't diagnose a single thing, and it for sure does not promise any specific birth outcome. What prenatal ASMR actually does is create a soft environment. It's an atmosphere where your attention can just stop bracing for a minute. It is a support tool, plain and simple. All right, Section 3, the science of sound. This is where we merge two fascinating fields of study. Full transparency here, there's definitely a gap in studies specifically testing ASMR on pregnant people. However, the evidence we do have shows incredibly strong parallel findings. On one hand, systematic reviews looking at music interventions during pregnancy show clear associations with reduced anxiety and better maternal well-being. And on the other hand, foundational ASMR studies demonstrate that people who respond to it experience legitimately reduced heart rates and better mood support. So the common thread isn't some magic frequency in the sound, it's the nervous system context. When sound is slow and pleasant, your brain interprets it as a safety cue. It shifts you right out of high alert and down toward rest. Our source material has this quote that just hits the nail on the head. ASMR gives the mind something soft to hold. Imagine you're lying in bed, you're completely exhausted, but your brain is running a marathon of all these what-ifs. Giving your brain a slow, predictable sensory cue in that moment is remarkably effective. It makes you feel less alone in the dark, and it supports slower breathing, simply by giving your attention a safe place to land. Let's move to Section 4, low-volume listening guidelines. This is all about the safe, practical application of everything we've talked about. Okay, let's walk through 4 really vital steps for safe prenatal listening. Step 1, and this is a biggie, keep that volume low to moderate. If you're wearing headphones, definitely avoid heavy bass, startling sounds, or marathon listening sessions that start to make your ears ache. The whole goal is ease, not intensity. Step 2, choose predictable, gentle content. Soft-spoken educational stuff or quiet room ambience is usually a much better bet than sudden, aggressive mouth sounds or harsh scratching. Step 3 is pretty fascinating. Pay attention to your shifting preferences. Pregnancy totally changes your sensory sensitivity, so a sound you loved a month ago might literally make you want to climb the walls today, and that is totally fine. Never force a trigger. And finally, step 4, use this as a short 10 to 20-minute routine cue. Pair it with dim lighting and a comfy position to clearly signal to your brain, hey, we're transitioning from doing stuff to resting now. Which brings us to section 5, and honestly the most critical part of this explainer, strict medical safety boundaries and knowing exactly when to seek help. Look, ASMR is a fantastic tool, but it should never, ever be used to ignore critical warning signs. If you are experiencing severe anxiety, panic, depression, thoughts of self-harm, reduced fetal movement, severe pain, bleeding, or honestly any physical symptom that just genuinely worries you, ASMR is absolutely not the next step. A qualified healthcare professional is. You need to turn off the audio and consult your doctor immediately. We have to remember ASMR is a complementary tool. It is not a medical fix. At the end of the day, the true strength of ASMR comes exactly from being a support, not a cure. It just gives your nervous system a softer room to sit in for a little while. Finding safe relaxation during pregnancy doesn't have to be this huge, complicated task. It really just begins with lowering the volume of the world around you, choosing a steady sound, and giving your body permission to remember that not every single moment needs to be actively managed, monitored, and worried about. So, as we wrap up this explainer, I want to leave you with a question to really chew on regarding your own nervous system. During your most demanding, stressful life seasons, whether we're talking about pregnancy or literally anything else, what actually calms you down faster? Do you crave total silence? Is it the rhythm of your favorite music? Or is it the comfort of a soft human voice? Getting a handle on your own sensory needs is always the very first step towards safe, effective relaxation. Thanks so much for joining me to explore this today, and keep paying close attention to what your body is telling you.